Hi, my name is Dr. Meredith Shockley-Smith. I'm the Executive Director at Cradle Cincinnati and the founder of Queens Village. Cradle Cincinnati exists to eliminate infant mortality here in Cincinnati and actually in our region. The Queens Village work focuses entirely on Black women and closing the health disparity in our outcomes. What we know is that Black babies are dying at 5 times the rate. It's a national trend, and here in Cincinnati, what we decided to do was focus on Black women and what they needed in order to close that disparity, and to think of them and to interact with them as leaders and to do what they ask us to do. And that is exactly what we did. And here in Cincinnati, we look at the trend over time, we see it trending in the right direction. So when we think about what it looks like to listen to Black women and center their voice in our interventions, one of the things we heard from them was that the headlines are reading Black moms are dying, Black babies are dying. What are hospital systems doing about that? And so as we were listening to that, we were thinking, well, we know that as leaders in our work, that there are lots of things happening in hospital systems that are going well, that we should be able to share with folks. And the things that aren't going well, we should be able to support them and change. And so from that listening process from Queens, we then decided to create a platform. Thankfully, every hospital system in the city of Cincinnati said yes, every birthing hospital, to turning their data externally facing, so that families know that we are all working together, rowing in the same direction to get at closing the disparity gap, and to see that number that we see all over the news lower efficiently and effectively. What we want to offer moms is not just that they live through their birth experience, but that they have a birth experience that is exciting and celebrated, and they feel joy as they are bringing a baby into the world. In order to make that happen, we reached out to the Health Collaborative, who has been an awesome partner because they are extremely data-driven. They're all things data. And what we know about interventions is that we want to drive with knowledge, and that without that data, we don't know if we're doing good or if we are just doing. And so the robust data work that they've done in the past and are currently doing in this partnership with Mama Certified leads us in the direction to not just hear families and do the intervention, which is so much of the battle. It also helps us to be certain that we are doing a good job in the work that we are doing. And so also to measure that as we move along the path, because we want to see progress. And in order to do that, we have to gather data with integrity, which the Health Collaborative does well. So the partnership with the Health Collaborative and Cradle Cincinnati and Queens Village works together to share data and support families in closing the health disparity in maternal and infant outcomes.
My name is Greg Kesterman. I am Health Commissioner here in Hamilton County, Ohio. In the early days of COVID, Hamilton County saw a need for far greater access to testing. The Health Collaborative stepped up and answered the call from the Hamilton County Commissioners and ultimately created the Test and Protect program. The program was designed to provide a no-cost PCR testing for all residents and employees within Hamilton County. The program was designed to create access to testing for those most vulnerable to the virus, yet was available to anyone who needed a COVID test. The program was a multi-sector effort. It included partnerships with hospitals, public health, laboratories, and community partners, all working collectively together with the Health Collaborative leading that discussion. The program focused on community building, it focused on continuous quality improvement, and was there to adjust and ensure program effectiveness as it continued to build. It truly ensured access for all residents remained a focus during the pandemic. It used a variety of tools to prioritize equity, including geospatial mapping, data analytic tools, feedback loops, and community circles to ensure that we were gaining better insight to determine testing locations. This truly met residents where they were when they needed testing. The Health Collaborative efforts to create lasting collaborations and partnerships within our community is so important for strengthening our healthcare system and ultimately results in better health outcomes for our residents.
I'm Dr. Nita Walker, Regional Medical Director at Aledade Incorporated. was involved with comprehensive primary care and CPC Plus in my role at UC Health when I was in charge of ambulatory services for UC Health. UC Health is an academic health system here in Cincinnati that is unique in that it takes care of a significantly complex population of patients around the Southwest Ohio. And many of those patients have significant medical conditions and comorbidities, but they also have lots of social vulnerabilities. So participation in CPC Plus really was an important opportunity for us to be able to think about how we expand care and provide better care coordination to the patients we serve. The Health Collaborative was really important to us for participating in that project. That project really required us to be able to have, number one, data to understand our populations, and required us to think a little bit differently about how we actually delivered care. So the Health Collaborative was really important to us, number one, because it convened activities and we would have convening sessions where we got an opportunity to learn about primary care transformation. We got an opportunity to collaborate and hear about best practices from other practices around the region and it was an opportunity, interestingly enough, for even competitive organizations to come together and engage in sharing in a way that made things better for the entire community. And not the least of the things that were done was providing data aggregation was a significant part of our work. It wasn't everything, but it was key to allowing us to better understand our populations and think about ways that we can change our health systems, improve our care delivery, and partner and coordinate across social service organizations, other community stakeholders, again, to really drive improved healthcare services for our complex population.
Hello, my name is Ashlee Young. I'm Vice President of Policy Engagement at Interact for Health. So when I think about COVID-19 and the impact that it's had on our community, one of the things, while it's been very tragic for our community, one of the things that I'm really proud of is the way that we came together collectively as a community. From nonprofits to hospital systems to just community members, we really all rallied around how do we work collaboratively better? How do we share resources? Entities around convening and having this really collaborative spirit was the Health Collaborative. And so I was really fortunate to really be on the ground working. I served in several of the committees, from the vulnerable populations group that they hosted, test and vaccination, the equitable strategies, our Black vaccination group, and also the congregate living. Specifically, what I am most proud of too of this initiative and collaborative effort is the intentionality around equity and racial equity. And so with the Black vaccination group, we saw a need. So people weren't necessarily looking at the data in a disaggregated way. And so because of that, our strategies were not as targeted. And so this group convened, the Health Collaborative was able to provide support for this group to really be intentional about what does it look like to not only get vaccination and testing into the community, but what does it look like to be intentional about our priority populations and making sure that those that have experienced the greatest burden of COVID-19 have access to the vaccine and testing. And so that was a huge feat. So again, you have folks looking at the data, and then also with the placement of the vaccination sites and the testing sites, just being intentional about where those were located. And I would say that that really laid the foundation to even how our community is operating today. That collaborative spirit continues to be embedded in how we operate, and the Health Collaborative continues to be that glue that really is a key foundational piece for us as a community, and really convening and having collective action around the biggest priorities that we see within our community.
Hi, I'm Deirdre Beluan, the Interim CEO for the Health Collaborative, as well as the Chief Strategy Officer. Today, I'm going to talk to you about model participatory grant-making approaches that the Health Collaborative has undertaken over the years, as well as the ways in which we've shifted power and influence to the communities, and finally, how we've made sure that lessons learned are shared across those communities. One of the best examples of our model participatory grant making was through our Accountable Healthy Communities, AHC, award that we received from CMMI. Before we even submitted the grant, we did one thing that was really critical, which was we brought together the broader community members, CBOs, federal qualified health clinics, hospitals, managed care organizations, really to understand that we as a community could deliver against the objectives of this grant. We were luckily awarded it, and we provided two significant things to be successful in that grant. One was financial accountability and controls, which allowed us to really have clear safeguards in place for all that participatory grant making to make sure that all of our partners really understood what was expected of them, how they would be paid, and what that documentation meant that was required to get paid. More importantly, that example of participation from the beginning, before we even submitted the grant application, carried us through the entire grant and allowed us to be flexible and responsive to the needs of the community, so that we could be focusing not just simply on documenting those social determinants of health screenings, but also delivering against those social determinants of health screenings that were so critical for our community members in need.
Hi, I'm Tiffany Mattingly. I'm the VP of Clinical Strategies at the Health Collaborative. My primary role at the Health Collaborative is to help support our work streams and our service lines through providing clinical quality consultation and bringing stakeholders to the table for conversations. The Health Collaborative really embraces and recognizes the power of the community coming to the table, their voices bringing together what they know needs to happen, boots on the ground, to make systemic change across our community. So many times the Health Collaborative will serve as a backbone organization. Will be awarded funding that we then disseminate out into the community to help those providers either execute on programmatic deliverables or help inform the Health Collaborative so we can develop flexible model designs to apply out into the community to make sure that we are meeting the needs of those who are doing the work, boots on the ground, or receiving the services from within the community. A couple of examples of this is the COVID-19 Test and Protect program. This was an $18 million program that was awarded to the Health Collaborative by Hamilton County through their ARPA funding to provide equitable access to testing and vaccination during the COVID-19 pandemic. We recognized that it was important to bring those stakeholders to the community before we even developed the model design, to help them, have them help us learn about what was needed within the community to ensure that we had access to, that would provide access to overcome language barriers, to overcome technology divide, to overcome transportation barriers, and ensure that everyone within Hamilton County could get no-cost testing for COVID-19 with minimal disruption to their daily lives. The people we brought to the table were subject matter experts: public health, the YMCA, Urban League, Sue Casa, Council on Aging, the Greater Cincinnati Foundation, are just to name a few of the folks that we would bring to the table to have these conversations, and not just once or twice, but weekly, multiple times a week, to review the data, hear the feedback from the people receiving the services, and then through that flexible model design, be able to make changes quickly to adapt to what we were hearing needed to happen out in the community. Another example is our CPC Plus program. This is a multi-payer payment demonstration project out of the Centers for Medicare and Medicaid Innovation. The Health Collaborative supported the largest program across the entire country, 560 practices who were working to transform their practices from fee-for-service to pay-for-value. We provided practice facilitation and technical assistance, disseminated lessons learned via multiple collaborative learning models, and really focused on data-driven improvements. The influence and the power was shifted within the systems and the practices to across a region. So the Health Collaborative really recognized again how important it was to hear from those who are actually doing the work, who have learned, who have overcome barriers, who are willing to be vulnerable and share what didn't work and how they had to make changes to ensure that they could be successful in these new models and payment programs. That is another example of how we were able to bring communities together, learn from one another, and then disseminate and share those lessons learned out amongst our stakeholders.